Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, if you have pain in your joints that is accompanied by other symptoms like swelling and fatigue, your doctor may have recommended to see a rheumatologist. Your reaction might be to ask a question, what is a rheumatologist? Well, a rheumatologist is a specialist who diagnoses and treats arthritis and other immune-related diseases and conditions. So, to discuss on this, we have with us Dr. Ankit Patwari, consultant rheumatologist. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Thank you so much, Doctor, for joining to Good Life, the health show. So, today we have taken the topic arthritis, but at first we'll have to know about rheumatology, rheumatologist, as you are a rheumatologist. So, people will have a notion that what exactly a rheumatologist does and what is the treatment procedure. So at first, if you would just put some light on what is rheumatology.
So rheumatology is a branch of medicine which deals with any type of arthritis or any type of autoimmune conditions.
Okay.
So it is a medical branch. We mainly deals with how to treat any condition medically, and mainly like just for heart we have cardiologist, just for kidneys we have nephrologist. So if anyone is having joint pain and swelling, any type of arthritis or any type of autoimmune disease, then the rheumatologist deals with it.
Okay. Now, there must be some common reasons to see a rheumatologist. So, what are those common reasons, doctor? What are those common diseases for which a person has to go and see a rheumatologist?
So, anytime most of the patients that we see in our OPD is mainly joint. They came with joint pain, they came with joint swelling.
Okay.
And is there any back pain, is low back pain, and normally they have some morning stiffness, knee joint pain. Again, rheumatology is not only about joints and joint pain and arthritis, it is also much beyond that. So many times people have many other symptoms like skin disease, lung disease, eye disease, anything, and ultimately they can land up in a rheumatology OPD. So it can be, can go to anywhere. So we mainly deals with anything which deals with any autoimmune conditions, the conditions which are affecting reactions going inside the body.
Okay, okay. Now, the topic which we have taken is arthritis. All right, viewers, our numbers are flashed on your television screen. So, if you have any queries regarding the topic we will be discussing now, please call up and ask your question. Doctor is right now with us in the studio, and he will probably give you all the answers. The doctor, coming to you again now. What is arthritis? A common thing which is being seen in people nowadays, and which is the age group we are talking mostly. So, first, let's talk about what is arthritis.
So, arthritis is basically joint pain, and there may be swelling of the joints, or there may be any redness inside the joints, there may be morning stiffness, there may be crepitation inside, and there are different types of arthritis. So, it is not only about the hands or legs, it can be there anywhere. So, our joints are there in hands, legs, in the back also.
Okay.
So, even there is a type of arthritis which can affect the back also. There is a type of arthritis which can affect the knees. So, as such, anything which is affecting the joints, causing inflammation or degeneration falls into the category of arthritis.
Okay, so we already had a notion that arthritis always is related with legs, but it's not like that. Any joints, which you mentioned that it can be back, it can be hands, isn't it, doctor?
Yeah.
Okay, now there must be some types of arthritis as well, doctor. So what are those types, if you could just tell us?
So, the most common arthritis that we say day to day in our practice is rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis affects the small joints of the hands, especially affects females or the reproductive age group. Osteoarthritis mainly affects the knee joint, and it is basically a normal degenerative process that happens in most of us when we will grow old. So, it is a knee joint degeneration. Then we have in the back we have spondyloarthritis or ankylosing spondylitis. Again, the arthritis can be affected with the eyes. So, we have uveitis can have, there can be something, people is very common fond of uric acid. So, it can also cause a type of arthritis which is known as gout or gouty arthritis.
Okay.
So, as such different types of arthritis are there. The commonly we see is rheumatoid arthritis and osteoarthritis.
Okay, so which is the common type of arthritis, doctor?
So, I just told that rheumatoid arthritis and osteoarthritis. So, these two are the most common things.
Okay, so mostly patient comes with that problem to you?
And also back pain. So, back pain like ankylosing spondylitis is very common condition. So, ankylosing spondylitis, osteoarthritis and rheumatoid arthritis, these three conditions form bulk of our OPD practice.
Okay. Now, if we want to talk about the seriousness of arthritis, although doctor will talk on that, but we have a caller at this point in time. Let's take the call. Hello. Hello.
ইয়াতে বিষৰ কথা কৈ থকা হৈছে আমাৰ যেটো অস্টিওকন্ড্ৰাইটিছ টেলাছ বুলি OCD যেটো প্ৰবলেম হয় এংকেলত যেটো হয় হেতুৰ কাৰণে ৰিউমাটলজিয়ে কিবা হেল্প কৰিব পাৰেনে টু ৰিকভাৰ ফ্ৰম দ্যাট
So, ankle joint, there can be different conditions. I did not have the exact term that she was telling, but normally in ankle what we normally look at is any inflammation of the joints. So, normally if there is any ankle active arthritis that the fluid is accumulating, then we normally treat it. Otherwise, many times these are sometimes surgical conditions can also lead to this, and these are mainly deals with the orthopedists who mainly manage with the surgical part of that conditions. So, I think the thing which you are telling is I think is surgical condition. I just did not have the exact name of that condition.
Okay, okay. So it's better to see a rheumatologist to rule out the exact problem, and then the treatment will be started at the earliest, isn't it, doctor?
Yeah, so mainly we deal with the medical part.
Medical part, okay. Now, doctor, there must be some common causes of arthritis if we are talking about whichever type it is, which is the common type you already mentioned. So what is the basic cause of this?
So, exact cause of arthritis is not known.
Not known, okay.
But ultimately there are many things which are there affecting. So, one of the component is like a genetic component. So, in the family if someone will have arthritis, definitely chances of arthritis rises in the family, but it is not 100% genetic.
Okay.
Then infections are one of the causes, and we have many types of arthritis which actually aggravate after any type of infection. In fact, after COVID-19 we had many types of arthritis spraying up. Then it is something to do with the hormones, because most of our arthritis patients we see young females which are in their reproductive age group when they have high estrogen inside the body. So, some hormonal changes are also there which is linked to this.
Okay.
Besides this, smoking is a very important factor for arthritis, and sometimes some diets are there which can cause arthritis, some drugs can cause arthritis. So, these are some of the causes, but the list is endless.
Okay, list is endless. So there must be some symptoms also, doctor, when a person will come to know that they have to see a rheumatologist. So when is that time? What are the basic symptoms?
So, basically when we see any type of arthritis, we have one question in our mind is whether it is inflammatory arthritis or it is a mechanical arthritis.
Okay.
So, most of our practice depends on an inflammatory arthritis where there is a swelling inside the joints and there will be pain, there will be redness, and the most important thing that we expect is there is some early morning stiffness. That means when anyone gets up in the bed, especially in the winter season, which is cold weather,
Okay.
then there is stiffness either in the small joints of the fingers or in the back. So, if it is lasting more than 30 minutes, it is an inflammatory arthritis. And
Okay.
we have other types of things which is mechanical back pain. Gout can cause a serious type of arthritis which is having severe pain in the night time, especially involves the first MTP joint. So, these are some of the symptoms of arthritis.
Okay, symptoms of arthritis. Now, is there anything to do with, like, is it a serious problem? It can lead to a serious problem when we are talking about arthritis, when a person has to immediately go and see a rheumatologist. So is there anything to do with that?
So, yeah, arthritis if not treated earlier and it is delayed, it can lead to some serious complications. So, any type of arthritis, whatever we deal with, now our goal nowadays is early diagnosis and early treatment, because ultimately most of the arthritis we do not have any cure.
Okay.
But if we diagnose early, it is good. Now, rheumatoid arthritis is just a joint disease which starts from the small joints. It can ultimately go in lungs, or it can go in the hearts and cause cardiovascular diseases, and which can ultimately lead to in fact the death of the patients in rare cases.
Okay.
So, we have seen lots of these comorbidities. So, arthritis at times initially think that it is non-life threatening, but yes, morbidity is very high, and mortality down the line will definitely can increase. So, seriousness can be there. So, early diagnosis and early treatment is the goal of our treatment.
Okay. Now, doctor, which is the age group we are basically talking about? You must be having a lot of patients in your hospital. So we have seen that when we used to talk about arthritis in earlier days, we already had a notion that elderly people would be coming through this disease. Now, if we talk about these days, we have seen younger people also having problems of osteoarthritis and all. So which is the age group where we are talking about, which is the number of patients which you deal with every day?
Yeah. So, arthritis nowadays actually is affecting each and every, every age groups.
Okay.
So, we are not expecting anything like osteoarthritis cannot occur at 25 years we are getting patients. So, In general, inflammatory arthritis like rheumatoid arthritis and ankylosing spondylitis, they occur in younger ages. So, like 20 years, 30 years, these ages. And osteoarthritis normally occurs after 50 years. But nowadays, because of many factors are there, our lifestyle changes are there, trauma factor, stress factor, and all things are, we are seeing osteoarthritis even as late as early as 20, 30 years. And also rheumatoid arthritis, which is normally we expect as 20, 30 years female. We are also getting rheumatoid arthritis at the age of 60, 70 years, or in fact small kids like 6 years, 5 years also in inflammatory arthritis. So now that age barriers nowadays actually going back.
Okay.
And we are getting arthritis at any age.
At any age. So it's nothing to do with the particular age as well, but we are getting
some
it in
arthritis are there which are commonly that we think. So suppose a 20 years female will come to us, we will think of some definitely inflammatory arthritis.
Okay.
And old age coming to us, we will think of osteoarthritis, but it's not always.
But you just mentioned about kids. 6-year kid is also going through an arthritis problem. So on that note, how difficult is to treat that person or treat that child, and how important is to understand the parents about the pros and cons of the treatment?
So like there are many types of arthritis in small kids, and what is very important and very common is juvenile idiopathic arthritis.
Okay.
So small kids even at the age of 5 years, 6 years, 10 years, they can cause arthritis. Now it is very important to convince the patients, and in fact many times the kids cannot explain us their symptoms. They just have some limping gait, they are not able to walk properly, and they think that there was a history of fall and they cause, and the swelling of the knee joint gets all swollen. So it is very difficult at times to convince, and in fact the parents are very much like things, because at this age the small kid is having arthritis, will it be lifelong? So yes, it is very difficult. So
they are not able to
manage.
accept the thing.
Yes, they are not, but ultimately they have to accept it, because if we don't treat it, they will start having damage, because arthritis can cause damages in the joints, and it is also in not the joints. If you don't treat it, it can go outside the joints, so it can go anywhere. It can cause it can go in the eyes, it can go in the lungs, it can go everywhere. So it is very important that we have to convince them that yes, it is an arthritis and
it has to be treated at the earliest. Okay, doctor, we'll have more conversation. We'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on arthritis with Dr. Ankit Patwari. Now, doctor, coming back to you again, we were having a basic idea about what exactly is arthritis, when is the right time to see a rheumatologist. Now, let's talk about the treatment part. Whenever a patient comes to you with the problem, what is the first thing? What is the diagnosis part? How do you deal with it?
So whenever the patient will come to us, we always take a very thorough history. So normally they think that rheumatology is diagnosed only by test, something like that, but it is pure history and clinical examination.
Okay.
So our 95 to 99% patients, when we come to us, we talk a good history, and with that history we are able to diagnose that what type of arthritis he is having. Now once we have the diagnosis confirmed, then we can make some tests. Again, there are many reasons for ordering some tests, like for diagnosing purpose, also to give some medicines so they don't have any side effects, and so on and so forth.
Okay.
Once we diagnose something, then we have to properly counsel them, not even the patient, also the patient family members. That is very important, and normally we start with medicines, and we have to be very thorough with them and gradually follow with them those medicines of arthritis.
Okay, so treatment part starts with the proper diagnosis, and if a test is conducted, then the treatment is started with a proper medicine. And do these problems also need a surgery, doctor? Is there anything to do with that?
So in early cases, if it is treated very nicely, we don't need surgeries.
Okay.
But yes, if the patient is not getting adequate treatment or is not treating it properly, this arthritis can cause the joints, damage the joints. And at the last is replacement of the joints or just changing the joint. So changing a joint will not solve the problem, because the basic process will always stay there. So ultimately it has to be a medical condition which has to be started with, and in the extreme, so if it has completely damaged the joints, then we take help of our orthopedics colleagues to change the joints.
Okay. Now, doctor, the equipments and the facilities have advanced a lot these days in all the hospitals, and we have a good number of doctors as well. So when a patient comes to you, the assurance which a doctor gives or the hospital gives for a proper diagnosis, and also the test part, because there will be a lot of questions and confusions in everybody's mind, and especially the patient's attendant. So will these tests be conducted or not, or is these just unnecessary? So on that note, how difficult is for you and your team to make them understand and to counsel them basically?
So nowadays the previous concept was patient used to come to us and we used to see and we used to order the test. Nowadays the reverse is happening most of our OPD practice. So already the patient, whenever he reaches to dermatologist, he is very late actually because there is a big bias in referral. So once they get referred, when they come to us, they already have all tests of sort done, and most of our tests for diagnosis already we get beforehand. But yes, sometimes there are some diagnosis which actually does not require any test. So just like a uric acid. So uric acid causative pain, there is no definitely test to diagnose. It is completely a clinical diagnosis. So we get biased when actually initially we get the test. So we normally actually see the patient first, history, examination, thorough examination, and 95 to 95% we make the diagnosis, and that for just 1% to confirm it, and for future treatment we give those tests. Now people think that why so many tests done if we have diagnosis, but remember we have to give proper treatment, we have to properly follow up, and we have to improve the blood reports sometimes so that the patient can also look at it, yes, it is improving.
Okay. So what are the basic tests that has been conducted? Is it an X-ray or MRI? Which is?
So there are lots of tests in rheumatology. So once we go to good history and examination, then we can go for some simple blood tests. So like we can look for markers of inflammation, some blood tests we can do. Again, for diagnosing some arthritis. So like rheumatoid arthritis is diagnosed by some blood tests, simple blood tests like rheumatoid factor and NTCCP. Ankylosing spondylitis, many times they have some test which is known as HLA-B27, which is a gene present in them. Sometimes we do an X-ray for diagnosing osteoarthritis or back pain. We have some findings which we can get. And if we are not convincing, we go for ultrasound, MRI. So it is the level of test that we can order. So it is very simple blood test to an X-ray to an MRI. All lots of tests are there for diagnosing a disease.
Okay. Now, doctor, when we talk about young or elderly, it's fine. But when we are talking about kids, we have to be extra cautious and extra precautions has to be taken. So the same procedure is being applied in both the patients, be it a kid or a young or an elderly one.
So kids diagnosis is more important by history. Like in young adults, we need some test, but in fact in kids, the pattern of arthritis which they are having, that simple history will tell in 100% of the diagnosis many times we have. Only once in a rare case we don't diagnose by history. But definitely they will also need some test ultimately afterwards while the treatment is started and how the treatment is monitoring. Many times these drugs have some side effects. So like we give some drugs which can actually goes metabolized from the liver. So before doing any arthritis medicines we normally tend to do this basic test like simple hemoglobin. What is the hemoglobin of the patient? What is the liver enzymes of the patient? So that the patient does not have any side effect, and if it is there, we can timely change the treatment so that he does not have to have any
So
side
after
effect.
taking a proper history, the medicines are being prescribed, and also you tell the do's and don'ts also and about the side effects to the patient and the attendant as well. Now, doctor, if we talk about the precautionary measures after the treatment, what are the precautionary measures one has to take while like leaving the hospital or going back home?
So like many times like patients like some medicines are given. So like suppose a patient is on alcohol. Now many of our medicines go or metabolize from the liver, so we tell them to don't take ethanol. In fact, some diseases like gouty arthritis can be precipitated by ethanol, so we told them not to smoke. Similarly, rheumatoid arthritis can be evoked by smoke exposure, so we told them not to smoke. So some dietary advice and some other factors we tell them. Some autoimmune diseases are there which can be flared by cold or some by ultraviolet rays. So many times when diagnosing them, they will just have simple joint pain, but the large diagnosis will be some autoimmune connective tissue disease like lupus or scleroderma. So these are some rare diseases, but yes, these are common, and based upon the disease, we give them some precautionary measures that they should take.
Okay. Now, doctor, if we talk about the medicines, now we have seen like how important it is to complete the course of the medicine, because we have seen someone like not taking the proper course or stopping the medicines in between. So how important is to complete the course, and then when you again call them for a proper checkup, so when is that time? Like how much of the duration is being in between of the treatment and the checkup?
So basically, once we diagnose them and give some medicines, we ask them normally the first follow-up to do very early, like 4 weeks, 6 weeks, 2 months, not more than that. Once the disease is stabilized, we ask them, don't stop the medicine, you continue the medicine, but we can prolong your checkup. So maybe it's 3 months or 6 months.
Okay.
So like if a patient is coming from Manipur, I cannot ask him to come every 2 weeks or 3 weeks. So normally we tend to give them a long, follow-up date. So like maybe 2 months, something like that, 3 months we give them. So only thing is the disease we have to stabilize. So if it is stabilized, if it is under control, so we have to convince them that it is, most of the time it is incurable. It will be with them throughout the life. So based upon that, we give them a 2 monthly or 3 monthly follow-up.
Okay. Now, doctor, we have seen like nowadays a lot of people, they like search things on internet, and like we can say we have doctors in every household. So we have seen that before going to doctors or specialists, like as you mentioned that when your patient comes to you, it's already sometime they come late because maybe they are having a proper search on the internet, and when they do a lot of like off-the-counter medicines, they take off-the-counter medicines and start their treatment at home itself. And when it doesn't work, then they go and see a doctor. So on that note, what suggestion do you want to give to the viewers?
So that should not be actually done. So what happens normally whenever anyone has pain,
especially the painkillers which they take.
Yeah. So anyone will have pain, the first thing will be, yes, I will go to the counter and I will give a painkiller and I will relieve the pain. And they think that it is just a simple pain. But sometimes those painkillers can also have some side effects. So painkillers are not always the treatment for arthritis. You have to properly diagnose it, and you should come as early as possible. So should be referred immediately. So it should not be delayed for 2 months and 3 months, because the time like which we are doing, already the disease will progress down. The painkillers will just reduce the pain for hardly 6 hours or 8 hours, and ultimately the damage of that arthritis will keep on happening.
Okay. Now, doctor, let's talk about the dietary part as well. Diet is also very important for any kind of disease and to have a proper lifestyle as well. So what would you like to tell? What are the things that has to be added, or what are the things that shouldn't be added in your dietary part?
So there are like many types of diets that we can advise. So what can be taken? So we advise them most of the time that you take a healthy normal diet which is taken, like green vegetables, plenty of cereals, millets, which is nowadays very much advocated by the government of India.
Okay.
Again, other types of fruits, vegetables, all is advised. Small fishes, we advise them. Among things which are really avoided is especially these fast foods, because our culture and lifestyles has now changed to the Western styles, and lots of fast foods are coming up. So we tell to avoid those fast foods. Ethanol we take to advise, smoking we advise them to stop it. So some foods are there which can cause a particular aggravation of the arthritis. So just like red meat or too much of high protein diet or seafood or sea fish can cause precipitation of the gouty arthritis. So if the patient is having uric acid pain, we told them not to take so much so and so diet. Again, osteoarthritis, many times they took very much of high, like anything which is coming packets, fast foods, and which is causing ultimately obesity, the fatty foods. So ultimately this obesity will ultimately cause a whole more problem of those things. So there are some diets which actually we normally advise what to eat, what not to eat, and there are some specific diets based on a specific disease.
Okay, doctor, we are really short of time. So what message would you like to give to our viewers who are watching our show?
So anyone who is having joint pain, swelling, or any multi-system problem like skin problem, eye problem, which is not resolving and is very lasting for some time, you should immediately refer to a rheumatologist. The rheumatologist will properly diagnose it as early as possible and give the best treatment, and ultimately it is the early diagnosis and early treatment which is the key to our success.
All right. Thank you so much, doctor, for coming to Good Life, and I'm sure the viewers who have watched our show must be benefited with the answers and the topic which we discussed today. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.